Hello viewers, welcome to Narayana Institute of Cardiac Sciences, Department of Cardiology. With me I have today Dr. Sanjay Mehrotra, who is our Director of Cardiac Cath Lab, and Dr. Bagirath Raghuraman, who is our Director of Heart Failure and Heart Transplant. I am Dr. Srikanth from Department of Cardiology. So this 29th September we are celebrating World Heart Day, and the theme is Use Heart to Beat CVD. Let me straight away go to Dr. Bagirath. Sir, this is a corona time, this is a corona pandemic time. Why do you think we should be discussing about heart diseases?
Well, we all are in the COVID era right now, but let us all remember that coronary artery disease was there before, it's there now, and it will be there in the future too. So, though COVID is a passing pandemic, there will be a time when it effectively wanes out. However, coronary artery disease is here to stay. So, it's really important for us not to forget the primary focus. Of course, COVID is important. It has to be given its due importance in terms of investigation and timely treatment. But at the same time, coronary artery disease is also equally important, and that also has to be evaluated. In this entire focus of COVID, let's not lose focus on coronary artery disease. That's equally important, that is here to stay, and that is still a very important point to determine quality of life as well as longevity, and can be fatal if ignored in the focus of COVID. So it should be given its due importance. Another point that I'd like to add is many COVID patients also have coronary artery disease. So both of them can come simultaneously. So it's really important that we maintain focus on both these problems simultaneously. Once COVID wanes out, coronary artery disease is here to stay.
Thank you, sir. Dr. Sanjay, in this era, how a patient with heart disease, can they wait, or what should they be doing when they have problems? What is your opinion about their regular checkups, which they are normally doing all this time?
You mean in relation to the time where we are dealing with the pandemic of COVID?
Exactly. So,
right. Yeah. So, if you look at the incidence of coronary artery disease all over the world when the COVID was peaking, starting from various other countries like developed countries also, the number of admissions for coronary artery disease came down. Exactly. So there was a concern in most of the people who are the treating physician across the world. Has it really any real reduction in the coronary artery disease?
Yeah.
Or it is people avoiding to go to the hospital? And most of the doctors thought that most of the people are postponing their visits to the cardiac centers, maybe not giving too much of value to the cardiac symptoms. For example, ignoring their symptoms of heart disease, like a chest discomfort, a gas-like sensation. And I'm pretty sure that the mortality must have gone because there would have been heart attacks. They will not stop.
Correct.
The only thing is that across the world, the pollution levels came down.
Yeah.
Across the world, people have stopped eating out. Although it's picking up again.
Yeah.
And across the world, I feel that people have started eating at home.
Yeah.
Most of the people stopped eating non-vegetarian food at this time. Okay. So I think there is a possibility, and a lot of people have lost weight during the pandemic because maybe it's anxiety, maybe it was just because they had a regular meal per day and they did not eat out. Maybe a lot of people lost weight. I mean, I know so many people who come and said, during the COVID time, I have lost weight. And that would be definitely advantage to a cardiac illness. So I would say, I agree with Dr. Bagirath, that the disease is not going to go away. It's except that maybe people have not taken care of their symptoms and stayed at home.
Yeah.
So, but of course, it would have been there. We have not known what, maybe we will come to know over a period of time. But as Dr. Bagirath said, that it's very important that you give value to your symptoms, don't ignore them.
Okay.
Any gas-like symptom, discomfort in your chest, breathing difficulty, you may have to go to a hospital. You may have to take certain precautions, maintain your distance, wear a mask, which is very, very important.
Yeah.
And if the doctors say you're all right, then you have to come out of that place and stay at home.
Yeah. So I can take two things. One is heart disease is a disease of lifestyle. COVID has altered the lifestyle,
Yes.
and
Yes.
that way it might have reduced the incidence of CAD.
Possible. We don't know.
The second
Too
thing,
short a time, Dr.
yeah,
Srikanth.
yeah. So, but then you are also telling like if they have problem, they should reach the hospital. And what do you think if they had a regular checkups, like periodic checkups for heart patients, they should continue to get it done? And how in your practice has a video consultation? Yes, sir. Video consultation has helped.
Yeah, I fully agree with what Dr. Sanjay said. 2 points that I have learned is, one is the corona has taught us the value of human life, more importantly our life, how it's so important to safeguard and stay alive through this crisis. So we need to take our precautions. The second thing is, as taught to us, that coronary artery disease is not going to wait for the COVID pandemic to subside and then show up. It is there, it's here to stay, and it can show up at any time. So it's really important that coronary artery disease has also to be investigated, and timely treatment is absolutely necessary. So this is an add-on to the entire gamut that Dr. Sanjay just alluded to.
So yeah, thanks, sir. So if they have heart problems, they need to seek help. That is the
Immediate
basic thing. So you can't wait for a better time to come. Yes, sir.
So, I mean, there may be two situations. That there are stable patients who are for a follow-up. Many times we call our patients, they come after 6 months, come after 1 year. And because of the COVID situation, they have not been able to travel. And a lot of them are actually anxious about it, that their visit was due, they could not come. What has helped is a video consultation.
Yeah.
And it has probably come as a boon to us for various reasons, that people did not have to travel.
Yeah.
We can actually see their symptoms and guide them. They could have done their test there, wherever they live. And we've been able to see their report. So that has helped a lot.
Yeah.
But any emergency situations, they cannot ignore. For example, somebody is breathless, somebody is uncomfortable. They have to go to a hospital, and obviously they have to go to the nearest hospital.
So
symptoms, as I said, of the cardiac illness, they come in the form of shortness of breath, discomfort in their chest, heaviness in their chest, breathing difficulties. These symptoms have to be taken care by a physician in a hospital setting.
correct.
For such symptoms, waiting for a video consultation for a doctor to come online is not a good idea.
Yeah.
So I would say for a follow-up patients who are just a regular follow-up, like post-angioplasty patients. A lot of our patients who have had angioplasties have gone home. We said come after 6 months to see, and they have not been able to come.
Yeah.
And they're very anxious about it. It's not that they want to follow advice of a doctor, but they don't want to come because initially there was no travel allowed. And now they're concerned about, because the number of COVID is still going up.
Correct.
I mean, for the first time I have seen that the recovery is actually more than the new cases today.
Correct.
We hope that pandemic will go.
Yeah.
But my personal feeling is that for a follow-up patients who are stable, a video consultation has worked.
Yeah.
And they can avoid traveling to a hospital setting where the COVID is a possibility.
Okay.
And also going through public places, public transport, probably should be avoided unless it is necessary.
Yeah. So the patients have a choice of having a video consultation if they are fine, but emergency should always,
Absolutely.
they should reach a hospital.
Absolutely.
And when you are telling about how COVID might have reduced the chances, so it means heart disease is essentially a lifestyle disease.
Correct.
Smoking, hypertension, obesity, diabetes, air pollution, as sir mentioned. So these are all factors which affect the heart disease. And this theme is use heart. Basically, use heart to beat heart disease is to use your thought processes. And sir, Dr. Bagirath, how should a patient use his thoughts to lead a healthy lifestyle? Like what he should be doing?
Essentially, this discussion is all about lifestyle changes, lifestyle modification. So all of us know the cornerstone in preventing cardiac diseases. One is to identify risk factors and treat them. The second thing is to maintain a healthy diet. Third is the exercise. These are absolutely important. Apart from this, know your numbers. You need to know your cholesterol values. You need to know whether you're diabetic and what is the blood sugar control. You need to know your blood pressure readings as frequently as possible, especially if you're on treatment. Make sure that the readings are all under control. Really important that you cut down on excesses in terms of diet. Of course, with lockdown, most of us have been indoors, most of us have been at home. The sheer fear of not going out has reduced the exercise levels in most of us. So it's really important for us to understand that we have to take our precautions, but life must go on. You need to exercise regularly. Very important to have a healthy diet. Please remember that only when you take all these precautions, you can prevent coronary artery disease. That's so important because prevention is always better than cure.
Sir, anything you want to tell about tobacco?
I mean, see, if you look at the heart concept which you're bringing in, know your heart, I can say that what you mean by bring your heart to prevent heart is something to do your discipline, your mind and thought and your whole composition of your body to become committed to a certain process.
Okay.
When it comes to lifestyle modification, the most important thing is the food. Of course, smoking is something you can prevent from tomorrow or from today. You don't have to think about it. What you need is a very strong commitment. So the discipline in life and the commitment is the most important thing.
Yeah.
Now, most of the time, smokers don't leave their smoking unless they suffer an event. For example, they suffer a heart attack. 90% would leave for some time.
Correct.
There are some rigid ones, maybe 100% will leave for some time. There are some very rigid patients, at least 10 to 15% who will come back to smoking.
Correct.
So smoking is something which is absolutely preventable risk factor. As far as lifestyle modification, diet modification is concerned, it requires certain commitment, certain lifestyle changes, because see, most of us work at least 10 to 12 hours a day.
Correct.
And you don't have time to do, and by the time you reach home, you're tired. So I would say the best time to, do all these practices of, even if it's a meditation, what calls mindful meditation, whatever you call it, exercise, you need to find time in the morning time. So the best thing is to get up early in the morning, finish your routine. Probably in COVID time, the pollution is going to be less and there will be hardly anybody on the outside. So the best thing, go early, finish your morning routine, and which is which is exercise, which is most important. And my advice to my patient is that eat regularly, but don't eat in between. So whenever you eat multiple times, you create a possibility of obesity. We call insulin resistance, and the most common cause of diabetes is eating sugar-rich diet, carbohydrate-rich diet, at least 5 times a day. So you eat in the morning, then you get some coffee, tea. See, I see so many people, especially in front of software industry. See, everybody's drinking tea.
Yeah.
You know what they're drinking? They're actually taking sugar.
Sugar. Okay.
So they come out and take sugars all the time. They drink that small cup of tea, which is mixed with tea sugar. So what you're doing
And a snack also.
And a snack also along with that. And that is also sugar only.
That's also sugar.
And that's a processed sugar.
Yeah.
It's a bun or a puff or whatever.
Maida.
So you eat 7 o'clock, 7:30, 1 coffee, tea with sugar. Then you eat a breakfast at 9 o'clock. Then again 11 o'clock, 2 cups of coffee with biscuits. Then lunch at 1 o'clock. Then 4 o'clock, 5 o'clock. Then 7 o'clock. And then dinner at 10 o'clock and go to sleep. This is the worst kind of lifestyle. What it does is it causes spikes in the glucose in your blood, which causes insulin secretion and produces insulin resistance.
Okay.
That insulin resistance is responsible for obesity, central obesity, and then you get diabetes.
So diabetes in turn leads to heart problem.
Heart problem and all kinds of other.
You get into the cycle.
Once you get into that cycle of becoming intolerance to sugar, your insulin is not working. If the insulin is not working, you're giving more insulin also. That causes more insulin resistance, which is what a diabetologist will do. He will give you more insulin to control. Just the sugar control is not controlling diabetes. It's an overall control. Your metabolic levels of the body has to change.
Improve.
There should be metabolic improvement rather than just the sugar levels.
Okay.
And that is why this repeated eating, I would recommend don't do. And of course, most of you have heard about intermittent fasting, values of intermittent fasting. And those things probably will come into vogue as the time goes.
Yeah.
And you can reverse your diabetes. And if you're not a diabetic, we don't consider you heart patient. If you're a diabetic, we consider you equally
Equivalent
for
of heart disease.
Yeah.
If you become a diabetic, we think you have got a heart disease. If you are a diabetic, you should get yourself checked up for heart disease. Make sure that you have a commitment
Yeah.
and your control of your mind. And the heart, I would say, to
Yeah.
control your lifestyle.
Okay. So, I mean, you are telling like you have to give rest to the body's metabolic system, like digestive system and insulin secretion, because every time we eat, there is a
You
insulin
don't need
secretion.
so many calories.
We
So-
don't need so many
Yes.
calories, and then you need to give rest to the.
Yeah. So you know,
If you give
look at-
rest, it will probably.
if you look at our ancestors,
Yeah.
my grandmothers, and I'm sure you will agree,
Yeah.
some of our grandmothers who lived 90 years, they used to fast every Ekadashi.
Yes. Sir.
Every 15 days, I used to fight with my grandmother, who was mother's mother. Every week, she used to have a fast.
Mhm.
This festival, that. So, all our ancient understanding was that if you fast the body,
Yeah.
it gives you potential to regenerate.
Okay.
So, when you are giving a trauma to the body by fasting, there is recovery happening in the body.
Probably I would call it as a you are giving rest to the body.
You're giving a rest
to the body
yeah.
to heal well.
Yes.
Heal well. Okay.
But it doesn't work by the rest. It works by causing a trauma. The body thinks food is not coming.
Mhm.
Then it tries to find out a method to correct it.
Mhm.
So then it regenerates new cells in the body. So your apoptosis is taken care of.
Yeah.
The body regenerates faster. And of course, the harmful effect of high sugar
Is
will not be there. So when you're fasting, your sugar levels will be low.
Absolutely.
yeah.
So the
Yeah.
what you call as hyperglycemia episodes will come down. Yeah.
I mean, Dr. Bagirath, as a doctor, what do you think? I mean, we spoke about general what we have to do.
Yes.
As a doctor, any message to your patients, what they should be doing to, I mean, how to use their heart to beat their heart disease?
Okay. So the most important thing is, as we've already said, the cornerstone of any treatment is lifestyle modification. I think it's more a control of our mind. If we are able to get a hold of things, eat only when we are hungry. It doesn't mean that you keep eating whenever food is available, or when the we are all victim to this, that if we walk into a colleague's room and there's food there, we eat. It doesn't matter whether we are hungry or we are not. But that keeps adding calories, plus having regular snack break or regular coffee break. So these are all important. So I always tell my patients that it's really important that you should probably have a wholesome meal and have it only when you're absolutely hungry. It's okay to miss a meal. It doesn't mean that according to the clock you have to eat food. That's important. I've always stressed to my patients that equally important is exercise, because though you're eating enough, your body needs good physical exercise. You need to burn those calories, and that's really important. Third important thing is to, if they are already on medications, to adhere to the medications. Compliance is very important. Don't try to skip tablets. And most patients come and ask me, does this mean that I have to take it for a lifetime? Well, absolutely yes. These are conditions that don't have a cure. They don't have a timeline. You need to take medications lifelong. Also important is, many patients tell me that now I'm feeling better, can I reduce the dose by half, or can I stop it for a few days and see what happens? Well, we can't experiment on life. It's really important that these tablets in the correct dosage have been given keeping the patient's condition in mind. So no compromise here. It's really important to preserve life, really important to stay healthy, stay fit, and these medications are designed to give a good quality of life and also longevity. If at all a decision has to be taken in terms of medications, it will be done by the treating doctor. This is really important. Apart from that, the general lifestyle, as well as completely abstaining from alcohol as well as smoking. Of course, in terms of alcohol, there can be certain regulations that can be followed. It's really important to keep off tobacco.
So, I mean, you are telling it's very important that they take care of the diet.
Yes.
They take care of their medications.
Yes.
And adherence.
Adherence.
Very important.
Compliance is very important.
Exercise. Stay away from tobacco and alcohol.
Yes.
If everybody has to do, once you are a heart patient,
Yes.
these are the 5 things which you has always to do.
Yes.
Yeah. And sir, how should an employer, if somebody is running a business or a industry or anything, there are a lot of people around working under him, how he can contribute to the benefit of the heart health of the employees. Anything you want to tell?
I think probably what Dr. Bagirath said, execution of that in the workplaces would also be important to sort of see that their employees are following certain pattern of life. A lot of organizations have started giving, private organizations have started giving incentives to people to do activity, and they're given exercise times.
Okay.
But unfortunately, and they also give you money. It's happening I know that in Tata Industries it happens. I know in US it happens that if you go and do one session in their gyms, they have created facility, you'll be given $10, but people still don't go. The reason being that they're not educated about it.
Okay.
I think there should be a platform of calling experts like you or some of us to go to these places and educate them. I think you do it. I do it many times. All of us have gone.
Yes, sir.
It's very important to educate the younger lot.
Correct.
Because see, the disease starts very early.
Exactly.
Disease starts, even the fatty streaks can be seen even at 1 decade of life.
Yeah.
And if your disease, which has become 90% at say 50 years of age or 60 years of age, it doesn't become 90% in one day. It takes 30, 40 years for you to reach that.
Disease to build up.
That's very important. The youngs of our country who are basically working for industry now. See, our country has the largest number of young people in the world.
Okay.
As an employee.
Correct.
So it's important that they are educated about it. They understand what is the importance of lifestyle modification, what is the importance of certain food, what is the importance of avoiding processed food, and then some incentive to them to get a check. They may have, people conduct these days camps to, doctors go and
Preventive
checks they do. And if you detect a problem, there should be a proper guidance given to those people through our organization.
Yeah.
How to change their life.
Yeah.
So I think the employers, because they control a large number of populations. For example, if there is hypertension which is coming in the young community, then you detect them time to time. So give opportunities for others to come and check in their premises the health checkups of these patients, and then of course a subsequent advice would be important.
So one is, they may be having doctor whose services they have to utilize, and the way the food is served, what kind of food can be made available, and having an option to have an exercise and conducting health camps. These will all should be done for the benefit of the employees. Dr. Bagirath, what is
you
it?
You can probably also add to the insurance coverage provided by the organizations. They should give some kind of value where everybody has an insurance, and which is a lot of organizations
probably
do
both ESI and private organizations.
They do it these days.
And I've seen insurance companies also providing health educations to the larger groups. So that's encouraging.
And I think like Dr. Sanjay covered all the points. Two important things. All of us have worked abroad. We know that the reason why there is a sports arena in any work organization is because in sports everybody is equal. So whoever plays there, let him be the CEO or a person lower down in the order. When you're in a game, there's equality. There is a chance to understand another person's perspective, and there are no work rules in this place. So it's a sports discipline that is enforced. So also in a community eating area, of course, in the non-COVID times, wherein all of us sit equally and eat equally. So camaraderie is better, our understanding, our work relationships are better, and overall our health, well-being, as well as comfort level with our colleagues and employees are also better.
That heart-related matter can be dealt in.
That's true.
And especially because almost 60 to 70%.
No, I'm not talking about the real heart. I'm talking about
use the heart.
Other heart.
So a lot of time is spent in the work hours. So most of productive
camaraderie is better.
Camaraderie is
so
really
that
good.
will definitely help their overall health. Any message to the government? What it should be doing? Quick this thing.
Well, the most important thing is to make health for all. That is, there should be accessibility, availability, and finance should not be a determining factor to decide quality of care. I think when we are able to break this governing factor, then it becomes health for all. It's really important that pricing should be controlled. It should be a national insurance program wherein each and every individual has access to the best healthcare facilities, and there is a common pool of payment, so there is no differentiation in terms of affordability. That's really important. Apart from this, I think implementation of all the national programs, and also emphasis on lifestyle modification measures, incentivizing it from at a workplace, can be the various ways in which the government can contribute. I must say that the most important thing is health for all and insurance for all, because that is the most important thing in a crisis, in a crunch situation, wherein we should be able to walk freely into the best of hospitals and receive the best of care without having an anxiety about how much it's likely to cost.
So Bagirath has covered most of the practical aspect of what is required to be done for provision of health. I have always felt that there is a complete lack of providing education about disease in the earlier age group of children. So it is important that you put in their education format from 5 years of age, 5th standard, let's say 12th standard, some learning about what is diabetes, what is high blood pressure, what is heart disease.
Yeah.
Because imagine, see, in our house, I have talked so much about smoking, lifestyle modification, that my children will never do it. Now, if you're taught about the harmful effects of smoking to a child when he's less than 12 years of age,
yes,
because most of the boys will start smoking around 12 to 14. It's very common. The pre-college days, they get exposed to smoking. And it's considered to be a fad to smoke.
Yeah.
Probably not anymore. So I think it's important if you tell them the harmful effects of this very early in their education program. So what hypertension does to you, why hypertension happens, why diabetes happens.
Catch them in.
Catch them young. If you catch them in and educate them, then they will follow it for a longer time, and they may not indulge into these acquired risk factors. And they may change their life. They may understand what is a good food and what is a bad food for them.
So the other thing is all these Fit India movement, maybe Pulse Polio. I mean, all those health programs are all. They'll definitely contribute to the overall.
Educating them early is important.
Yeah.
Especially for lifestyle diseases. See, because you have controlled polio, you have controlled all the diseases. Thankfully, you might be able to control corona also. We don't know how. When is the vaccine coming? How will we control it?
Because for lifestyle, as sir said, it starts at that age. You need to start. You need to start
once
when they are
you
young.
form a pattern of your life and you become an adult to say, I like this and I don't like this, you're stuck.
Yeah. So
once you say, I like this and I don't like this, you're stuck. So before that, this likes and dislikes.
It should be.
And that's where your heart comes again.
Okay.
The mind and heart will come there. So I think that is an important aspect, I would say, to be provided into the curriculum.
Yeah. So government has a lot of things to do, and they are doing. I still think they are taking right steps, like Fit India movement. All those things will help. Generate awareness about being fit and eating healthy and those things. And I mean, now there is also everybody is telling, be thankful to your corona warriors. What do you think, sir? Being thankful, how do you think, both of you can tell me, how do you think being thankful helps their own hearts?
Yeah, so I'd like to say that at the very beginning, our respects to the corona warriors who laid down their lives in this battle against corona. Also, our full support to the corona warriors who are battling it out, especially in hospitals which have less facilities, risking their lives in order to save precious human lives. So, at the end of it all, I must say that we are all grateful that we are still alive. We have a chance to still serve our patients. Of course, in all this, it's important that we have to keep safety measures as with utmost importance. We have to make sure that nobody gets infected. So make sure that all precautions are taken. It's important to preserve life. It's important to maintain patients in their best health, and above all, live with dignity. So it's really important that we observe all the measures that are required to make sure that we are able to treat patients to the best of our ability.
So, I mean, just to add what Bagirath has already said, and I don't think I have many points to add. But the most important thing is that those who have been the front line treating COVID patients are really courageous people, because although I must say that doctors would not stop themselves in treating whenever it comes to treating. I don't think there would be any doctor who will say, no, I will not treat this. Given an opportunity, even if there is risk, he will take precaution, will still go ahead and do his job.
Yeah.
And that is what is done by most of the people in frontline who are treating COVID patients directly. Now, and there are patients in cardiac disease also who come to the emergency, and we are now finding that they are corona positive. That doesn't mean that we are not going to treat them, we will still treat them. So I think I must congratulate all those people who have put their lives at stake in treating, and in the process, some young lives have lost, lot of people died. The number of mortality in doctors is very, very high. I got a list of doctors, how many people have died in this country. They would have not died otherwise.
Correct.
But seeing patients, that's number one. Second thing is that the burden of disease has to be taken care of by the people themselves. And if they lose their guards, they start behaving like there is no disease, they will only increase the load on the hospitals and the doctors.
Resources. Yeah.
So ultimately, the person who would be affected would be the doctor, because ultimately they have to go through somebody. All those people who become sick ultimately go to the hospital. I would also say that please do not hide your disease, because a lot of people are hiding disease, and if you treat corona early, you can actually save lives.
Okay.
When you reach a point where oxygen saturation is falling already, people have kept the oximeter at home and their saturations are falling, then they go. If your oxygen saturation is falling, your lungs are gone. So go and approach a clinical setup early so that your complications will be reduced.
Treat early.
We have learned corona. There is an understanding that the corona can be reduced in its complications by treating early. So for example, there is markers of inflammation going up, you can get an anti-inflammatory. Steroids have worked well. And then if there is a risk of patients likely to have a thrombosis in his lungs, where the blood would clot, we can give them blood thinners. And of course, there are antiviral drugs which are effective in the mild to moderate corona. If the corona has reached a certain point, the drug will not work. So it is very important, please do not hide your disease. People come to the hospital and they don't tell that they have had fever, and they expose everybody around them. So if they have fever, if they have cough, if they have some concern about corona, get it tested and go to proper consultation to somebody who knows how to treat that. And please do not hide your disease. This is what message I would give.
Thank you, Dr. Sanjay. Thank you, Dr. Bagirath. I'd like to thank all the viewers for having listened to our discussion. Use heart to beat your heart disease. Take care of yourself during the corona times. Whatever guidelines are told, whatever you have learned, whatever you listened, use your heart and brain to follow them and stay healthy. Thank you, everybody.
Thank you.
Thank you.
Dr. Srikanth. Thank you, Dr. Bagirath. Thank you.
Thank you.